A very good afternoon and welcome to our session on the topic Ovarian Reserve and Fertility Potential. We are glad to have Dr. Mangala Gowri among us today to help us understand the topic. The doctor will take us through that more in the session today. If you have any doubts, post it in the comment section and the doctor will help you answer it. Be there till the end so that you don't miss out the important details of the very important topic today. And also, as the doctor will be answering the questions in the last of the session, stay tuned. Doctor, you have the stage.
Hello, good afternoon all. I'm Dr. Mangala Gowri, fertility consultant and IVF specialist, Apollo Fertility, RR Nagar, Bangalore. Today I'm going to talk about low ovarian reserve and fertility potential, which is one of the most wanted topic because since last decade we have observed that number of low ovarian cases have gone up drastically, and low ovarian reserve is one of the major causes for infertility. And we do get many couples who have got a lot of doubts regarding a low ovarian reserve, and mainly they want to know what are the chances of getting pregnant with their own egg when they get to know that they have got low ovarian reserve. So, to explain in simple terms, low ovarian reserve means woman will be having less number of eggs remaining in her ovaries to get pregnant. So here, couple has to understand that less number of eggs doesn't not only mean that it applies to quality, it applies to quantity, it applies to quality also. Lesser the quality, that means to say lower the quality also. So this lower quality also adds on to decreased fertility potential that delays conception. So it's very important to evaluate all the women for ovarian reserve who meet fertility specialists seeking for pregnancy. So early detection and active management of these low ovarian cases are very important to achieve the pregnancy, especially in younger women, so that they can have the pregnancy with their own egg and their own biological child. So usually, such kind of woman, any woman with a low ovarian reserve, do not may not have any symptoms, or sometimes they may present with the shorter cycles, with difficulty in conception. They may have 23 to 26 day cycle, or sometimes they may have excessive bleeding during periods because of anovulation, or sometimes they may have history of previous miscarriages. But these are the only few symptoms what we recognize during when we are taking clinical history, but they may not have any other significant history at all. So there are two important tests which we consider while evaluating any woman with low ovarian reserve, that is AMH and antral follicle count. AMH is the anti-Mullerian hormone blood test. It is not cycle dependent. That means to say it can be done during any day of the cycle. So usually women with AMH with 1.5 to 2 or less than that, we categorize them under low ovarian reserve. So lower the AMH, lower is the fertility potential. That's what the couple has to understand. That means to say a woman with AMH of 0.5 or less than that may have lesser chance of natural conception, or even with the fertility treatment, the chance of pregnancy may be low when compared to women with 1.5 or 2. So the second most important ovarian reserve test is antral follicle count, which is done on ultrasound. But it is a basic antral follicle count is taken within 5 days of periods on ultrasound. So usually, a woman with antral follicle count of less than 5 to 6, we categorize them under low ovarian reserve. Usually, any reproductive woman with antral follicle count of 8 to 10 in either ovaries, we consider them as normal. But somewhere around 6 to 7, we consider them okay on average. They are average women who have got good fertility potential, but less than 6, we categorize them under low ovarian reserve. So, similar to AMH, even and low antral follicle count cases, the lesser the antral follicle count, lesser the chance of pregnancy. Better the antral follicle count, better the pregnancy rate. Woman, that means to say, a woman who is having 2 to 3 antral follicle count on either ovary have got lower chance of natural conception or conception through fertility treatment when compared to a woman who is having antral follicle count of 5 to 6 in either ovaries. So many women, when they come to us saying that they have a low ovarian reserve, first and foremost, question they ask us, why they are, what is the cause they are having low ovarian reserve. So the first and foremost reason is the age. So one of the age is one of the most determining factor of ovarian reserve, both for quality as well as quantity. In Indian women, the egg reserve starts declining from 30 to 32 years, but more drastically after 35 years. I have come across many women saying that they want to postpone their pregnancy for whatever the reason. But all these women have to keep in their mind that the chances of natural conception or with fertility treatment reduces as their age advances. So one good advice from our side is that better they freeze their eggs or embryos, which are possible, so that they can use them in future for better pregnancy rate. So the second important factor is endometriosis, which is known to affect ovarian reserve both in terms of quality as well as quality. Any woman, if we come across endometriosis, we suggest them to conceive as early as possible before it affects their fertility potential significantly. Surgeries which are done on ovaries may be for ovarian cyst or ovarian cancer or ovarian torsion, or chemotherapy or radiotherapy which are taken for any cancer can all reduce ovarian reserve. And I would like to mention that even infection of ovaries can also reduce ovarian reserve. So, adding factors like smoking, environmental pollution, diet, all these are known to definitely add on to reduction in ovarian reserve. So, what could be treatment for low ovarian reserve? Is IVF always? So that's what the couple is going to ask us when they come to us. So I would like to say that any fertility treatment for any couple with low ovarian reserve depends mainly on two factors, that is age of the female partner, and second one is the extent of low ovarian reserve. Age means if the woman is less than 30 or 32 years with antral follicle count of around 5 to 6, that means to say AMH is around 1.5 to 2, definitely they can try, they can go for 2 to 3 cycles of IUI, if provided her tubes are patent, and the husband is not having any fertility issues. But if the woman's age is already 35 years with the antral follicle count of around 4 to 5, or if they are having, in any case, if they are having any other fertility issues like male factor infertility, better they undergo IVF. If the woman's age is more than 40 years, most of the time donor egg IVF would be the option, except in few cases. So overall, I would like to say that if the ovarian volume is low, irrespective of the age, if the ovarian volume, that is the size of the ovary, is low on ultrasound, or if the antral follicle count is very low, maybe 1 to 2 or 1 to 3, with AMH less than zero point 0.5, most of the time such kind of woman will require donor egg IVF, except in few cases. Okay. Overall, I would like to say that whenever a couple get to know that they have got low ovarian reserve, better they talk to their fertility specialist in detail regarding the fertility treatment, so that they can go for the fertility treatment as early as to achieve the pregnancy. Thank you.